Catriona Pagliari. Catriona is now the NHS for Yes campaign. She's a consultant radiologist in Glasgow, specialising in breast cancer diagnosis. She made her degree from Glasgow University and was first appointed as a consultant in London. She's now back in Glasgow, working in Stobhill Hospital and also the West of Scotland Breast Cancer Unit. Could you please welcome Catriona Pagliari?
Thank you very much. Thank you for the invitation and for the introduction. So I'm an NHS consultant. I'm a member of NHS for Yes. We have 350 members roughly that have signed our membership, signed our declaration now. And so I just want to talk about the NHS in this debate. And the Scottish NHS has always been separate from the NHS in other parts of the UK, but our funding comes from a block grant which is given to us from Westminster. I'll try to explain how Westminster policy can affect our NHS. Privatisation is rolling out now in England after the Tories' recent Health and Social Care Act of 2012, and that document removes the legal duty of the Secretary of State for Health to provide universal health care, and it actually dismantles the 1948 Health Act. It's no longer a legal duty. And NHS services are now forced to go out to bidding for private contractors to any willing provider. Billions of pounds of services have been handed to private companies to run such things as GP services, out-of-hours services, cancer care and screening. And Richard Branson is now the second largest provider of services in England. The private sector cherry picks the most profitable and straightforward parts of the service and leaves the expensive, complicated parts like the intensive care units, the complicated operations, the patients with chronic illness it doesn't want to deal with. And when you put profits before patients, standards can also fall. We've seen this with emergency services run by Serco in Cornwall. They put in cost-cutting measures. They replaced medically trained staff with call handlers, some of whom didn't have sufficient medical training, and the ambulance call-outs went up fourfold. And they can also hand back services if they're not profitable. We've seen that as well. But the cost just to run the internal markets in England was estimated earlier this year at £5 billion. Now that £5 billion is our entire staff cost for one whole year in Scotland. It's an enormous amount of money, and it's a complete waste of money. But if you look up, there's a report by the Commonwealth Fund. It's a Washington-based organisation, and it compares health services all over the world, and the Scottish and the UK's NHS services came out top overall for quality and access, but also the NHS was second cheapest overall, and the one that was worst was the American system, and it was more than double the cost of the NHS. So why has each successive, because it is each successive Westminster government taking us down the privatisation route, and if the evidence is to the otherwise, it's because there is an ideology to privatise, and that includes the NHS. And what we're now seeing is the final cementing of the Thatcher plan, which was laid out as far back as 1983. And what will happen is that the NHS will emerge in England as a clone of the American model, where we all need private healthcare insurance and charges. And having worked in London for a few years, the changes that were brought in by New Labour, quite frankly, Thatcher could only have dreamt of. It was things like payment by results, rolling out the private finance initiative, choose and book under the guise of patient choice, and independent sector treatment centres. In fact, one was planned in the hospital where I was working. So Labour brought in the mechanism to privatise the NHS and left the door open. And although they might roll back some of the changes, they are still committed to using private sector involvement in the NHS. Make no mistake about that. And over time, this will lead to shrinking of NHS funding. So our budget will be cut as well, because we get a proportion of the spend that's spent in England. And charges have already been discussed down south, for example, for GP visits, or for example, for a monthly NHS membership collected with your council tax. It's not yet happening, but it's being talked about. But our politicians in the No campaign are telling us that actually it's not happening, and they haven't seen hundreds of people marching from the north of England down to Westminster. If you've seen that, probably because they've been watching the BBC. It's not been covered. And they're telling us because we're devolved that it can't affect Scotland. Well, that is just not true. So cuts in the next few years measures both Labour and the Tories have signed up to, and if you add to that our share of austerity cuts at 2.5 billion, it would be really difficult to protect the NHS in the future. And also there's another thing, it's a European-American trade deal which may happen. It could lock in NHS privatisation, it could be very difficult to reverse. But if anybody saw the second debate with Alex Salmond and Alistair Darling, I was certainly cheering on the lady who asked about the NHS. And if you saw her, she said, "I hope, Mr. Darling, you can feel the weight of an Iron Bevan on your shoulders." And that was, for me, one of the best lines in the whole night, apart from Mr. Darling's slip up of course, you can use the pound. But on a different note, I have a young daughter who loves Disney's Frozen, and when I say she loves it, she loves every single song from Disney's Frozen. So, but unlike Elsa, you know, the cold does bother a lot of people who can't heat their homes and who can't put food on their table. And the reliance on food banks is a national disgrace, but it's also set to get worse. We can do better than that. So I'll read to you the 1948 NHS leaflet, which a part of it I'll read to you, which says the NHS there are no insurance qualifications. It's explaining what it meant. There are no insurance qualifications, but it is not a charity. You all will pay for it mainly as taxpayers, but it will relieve your money worries in time of illness. And that's why we have it. So this vote, for me, is about what path you want to take Scotland on for future generations, but also when we are no longer here. It's not about which government, which policy, it's about the longer term view for me. And I think we must vote yes to protect our NHS against the changing colours of different governments, take it right out of being a political football, enshrine it in a written constitution, something which Alex Salmond has talked about. And I'll finish with a final quote from Bevan from 1952, and he said, "Society becomes more wholesome, more serene, and spiritually healthier if it knows its citizens have at the back of their consciousness the knowledge that not only themselves, but all their fellows have access, when ill, to the best that medical skill can provide." And that sums it up perfectly for me. So that's why I think we must vote yes in the 18th of September and make it a legacy which we can be proud of. Thank you.